It's great to be here. I can't wait to talk more about this campaign, which is really good to.
Programming. My intention is to bring my experience as well.
I would have moments where I would just not be okay around people.
As a social worker, I have always wanted to impact people and help.
Some of our young people get trapped in that pipeline at 16.
Has a mental health disorder and or diagnosis, when he or she has an episode, like they're not even conscious.
Too, to see, okay, how are we taking care of these human bodies behind bars?
Let's invest in people and not prisons. Good evening, everyone. Mark Graham here again for our second interview, and today I have the honor of introducing and bringing in a distinguished guest of ours, Mr. Michael Galipeau, and I'll let Mike share his story, because one of the things that happens with us as people who are concerned about what's going on in the community, and we have a story, we like to share our own story. So at this time, Mike, I'd like for you to, share a little bit about yourself. Tell us who you are, why you got involved, where you from.
Yeah, so I'm from Dutchess County, New York. I live in the Hudson Valley, and I've been here for a number of years. And I got involved with the campaign because I was involved in working in a drug court as a recovery peer advocate. And I have been working for several years supporting people who are participating in our drug court program, as well as people who are incarcerated, and also people who are connected through a variety of different sources, including the probation office and other treatment programs, as well as people who call our hotline, because we have a helpline in Dutchess County that people can call for support. So I spent the last few years of my career doing that in service to my community. And so there were, some very obvious areas of improvement that I noticed, and we did a lot of work to try to create the improvement that we could. But a lot of the design of the program has some pretty serious limitations that align with my own personal lived experience, having come out of a drug court program myself. And so I'm happy to share more about that with you all as well.
Yeah, Mike, tell us a little bit more about this, your experiences in the drug court, and basically what led you to even be in the drug court.
Yeah, so to really unpack, and I'll try to give the shortest version possible here. But my experience with the legal system started when I was a child, and I had gotten involved in connected to a treatment program when I was young. I actually had an incident where I had skipped school with a couple friends of mine, and I drank for the first time. I really didn't know what I was doing. And the very first time I drank way more than I should have. And I wound up being hospitalized. I had alcohol poisoning. I was on the verge of being comatose. So it's pretty severe. And it gave my parents a really good scare. And so kind of following that, I had really been, struggling with also being bullied and not really being accepted in school. So, the way that people cope with that oftentimes involves, turning to places where they feel accepted. And the places where I felt accepted, the kids who were the outsiders, the kids who were the bad kids, quote unquote, there were certain things that we did together. And some of that involved using substances. And mostly I just felt compassion for the people that I was hanging out with. And I was really grateful to feel accepted. And I didn't feel like those people judged me, for being who I was. And that was huge. That was really big. But at the age of 12, I was at a treatment program. It was an outpatient treatment program. I really liked this girl who was in the program, and I wanted to impress her. and these other two guys who were in the program. And this is kind of a preface of what happens in jail settings, actually. I was surrounded by people who also came from very disparate circumstances and also had learned behaviors, that they were sharing between us, right? Like it was like an incubator for those things. So they thought, because this girl liked cannabis and I knew that she liked cannabis, so they thought they would help me out, and they're actually being kind of mean a little bit. So they told me that I could go ahead and roll a joint in toilet paper, which I knew absolutely nothing about what I was doing. I was 12 years old. This was like, so I went outside and I tried to light this thing on fire to be cool, to try to impress this girl. And it just went up in flames. Totally did not have the desired effect at all. It was completely foolish. But it was enough to get me in enough of a situation that I wound up being taken from my family on a family with service needs petition. And I was placed into a group home and institutionalized at the age of 12. And the place where I lived from that point forward was very much like a prison. And so, I would not have been able to distinguish where I lived from a prison. For all intents and purposes, it looked like a prison. It ran like a prison. I wasn't old enough to know what a prison was, but when I finally landed in a prison, it was very easy to acclimate. And I was also very aware when I arrived at this facility that I could count on, one or two hands at any given time how many of the children that were in this facility looked like me. And when I say that, I'm saying that the children who were there were mostly, Black Americans and people from the Latin American community and other diverse people that did not look like me. And so it was very clear who was being focused on in terms of whose children were being taken away and put into a place like this. And so what this place did prepare me for was going to prison as an adult, right? So you could say I went to boot camp. I went to prison boot camp. And a lot of really horrendous things happened to me there. I was pretty severely traumatized. I was drugged very heavily. So one of the things that I learned while I was there was that if I couldn't control my behavior, there was a substance that I could take that could control it for me. And that was something that became anchored in my identity from a young age. By the time I was 13, I was being forced to take 13 different pills a day. I was severely medicated. If I tried to refuse the drugs that they were forcing me to take, they would pin me to the ground with a 5-point safety restraint, with staff members that were as large as 350 pounds. And if I still refused to take the medications after being pinned to the ground and forced, they would hold me in isolation until I submitted. So they would take me and put me in a room that was about 4 feet wide by 8 feet long with a single wooden bench to sleep on. And you would stay there under the supervision of a staff member who wasn't allowed to talk to you indefinitely until you submitted to their authority. So I spent many weeks of my life at a young age in complete isolation. I ate my meals in there. They would let you leave to go to the bathroom, but that was it. So it was really hard. On top of that, there was a lot of chaos in the facility because unbeknownst to the residents, what was happening behind the scenes, the people who ran the facility were serially and routinely sexually assaulting many of the young men who were living in this facility. And it was only men who were in this facility. So I was also completely isolated from people of the opposite gender as a teenager, which I don't know how folks relate to that, but having a high school girlfriend, going with a girl to junior or senior prom, those things were not available to me. as a child. So this limited severely in many ways how I developed. And instead I was surrounded by people from some of the roughest neighborhoods from around Connecticut who had the most difficult childhoods, many of whom were criminals themselves or were members of organized crime. And at one point, I had, because I was a little bit ignorant going into this, found myself in the crosshairs of one of those groups. And I actually was held prisoner and tortured for 3 days while I was in this facility. And the other young men told the staff that I was AWOL. When I finally escaped and I got out, I didn't dare tell the staff what happened. So I just took the punishment for being AWOL. So then on top of being tortured for 3 days, I got punished and held in isolation for several weeks. So it was probably the least possible therapeutic environment that you could possibly put a human being in. And I share all of this to say, like, that's what we're doing now by putting people in prison. And I'm just going to let that sink in. Like, that's what we're doing right now.
All right.
To people and send them to prison.
So Michael, let me ask you a question. So from there, you graduated to prison, and then when you was released from prison, what happened? Did you get any therapy while you were in prison? Even when you was an adolescent, did anyone ever diagnose you with any type of mental health disorder?
Well, there was a lot of pressure to diagnose, and that actually became a problem when I got older, because they diagnosed me with a bunch of conditions. Because see what happens in the group home system, if you need what's called a quote unquote higher level of care, they get paid more money, right? And if you go there on a parole discharge to one of these facilities, they get even more money. So a lot of the decision making for the facilities was driven by money. So there was an emphasis to diagnose children and medicate them because it was billable and it would pad their budgets. There was also an emphasis on bringing in the children who had the greatest issues in high concentration, because they would get 3 times as much money to take somebody who was there on a parole release as opposed to somebody who was there on a DCF or a service needs petition placement. So the way that the fee structure was set up, it created the most unsafe environment possible. So to go back to your question, what ended up happening when I encountered the justice system years later, after years of chronic homelessness, right? So I got discharged from this facility to a homeless shelter where I met my military recruiter. And then because of the diagnoses and the treatment that I received in DCF, which the recruiter and other clinicians did not feel was accurate, I was discharged with a fully honorable medical discharge before I was able to complete my term of service because those records came to light. So I was shipped out quick, fast, and in a hurry home with no resources, no support, and I was able to get absolutely nothing in terms of financial benefits from the armed forces. So I was homeless again, just shortly after, and then for almost another 5 years after that. And it was while I was homeless, that's when I really started to have struggles with alcohol use primarily, and then eventually other substances, but primarily alcohol use for most of that time. And when I did finally encounter the justice system, because of the mental health diagnoses and the focus on other illnesses in my clinical record, and the lack of a history of other drug crimes, they actually refused to allow me to do a drug court treatment program, even though I had been arrested for drugs, because the allegation was that I was selling the drugs. And so if I was selling the drugs, I must not have a drug problem. But in fact, I'm a problem. And so they did not even give me a chance. I actually tried to get into the drug court program. I was refused. I was told by the program that I wasn't a qualified candidate because, you know, I didn't have the history of substance use disorder that they were looking for. Primarily because I was transient homeless and didn't have a healthcare provider. And it wasn't reflected in my earlier record either, because I was diagnosed with a bunch of other things that weren't really accurate. So the first time I went through the court system, they did not allow me to go into drug court. So I ended up doing time in prison. When I got released from prison, there was an option to go to a recovery house under the ATR program. A lot of places have done away with the ATR grants because there have been a variety of issues with those grants. But the access to a supportive living environment when I got released was actually really helpful. Unfortunately, while that was going on, I got re-traumatized because my girlfriend died from an overdose. And because we were living in a recovery house and the way things were so tight with all these rules, I was afraid to talk to anybody about what happened because we weren't supposed to be dating people that we were living with, right? And so, like, and also I didn't want to get in trouble with my parole officer because I had to talk to the police. So I hid the evidence that was there, that she had overdosed. I actually took the stuff and I like discarded it before I called the authorities to come and see what happened. And I also just didn't want like her family to see her that way. I felt really deeply ashamed of what was happening with her. And I just didn't want people to see her that way. And I was also really afraid for myself that I would get in trouble or get punished because of what happened. So, you know, all of the treatment programs I was in had, you know, I was basically forced to sign releases that, you know, they would disclose any information to my probation or parole officers. So there wasn't really a place for me to talk about what was coming up because I was so afraid of getting in trouble that I couldn't actually get the help that was available. And that was a big problem. And that's still a problem in the way that the drug courts are organized now. Like, it's still a major problem. You know, me as a provider, I can use my judgment to say if are aligned with the participants in the program, and we'll just openly share information through those releases with the drug courts. And the drug courts ask for a lot of information. And a lot of information I'm not sure they entirely really should have. And that was something I felt really conflicted about working within the drug court, was they were always asking for information, you know, trying to verify things. It seemed like they were trying to like trip people up and see like, oh, okay, is this person doing absolutely everything that they said they're doing? It seemed very like micromanaged, and people didn't have any space to have a human process. You know, like going through recovery is not easy. And when you don't have structure in your life for so long, trying to do something where there's all of a sudden a ton of structure and any little mistake sends you back to prison is completely nerve-wracking. Like, if there was something about the current drug court system, like that would almost certainly make me want to go back out and use again. It's the enormous amount of stress that it puts on the participants to try to be absolutely perfect and make no mistakes at all. And I watched that happen to a lot of the people that I went through this drug court program with. People were going in and out of prison. It was disrupting their jobs. It was disrupting their homes. And a lot of people ended up walking away from that program saying, I wish I never had even done this, because it felt like a trap. And so because it was so disruptive, there wasn't a real space for a therapeutic relationship to develop, because people were so afraid of consequences that they couldn't even be honest about what they were struggling with. And then when you add to that, on top of that, faulty drug screening technology, right? Just in my case alone, and I had a year, I'd start on working on my recovery when I got back into contact with the court again after I relapsed because of my girlfriend dying, and then getting injured after that. And it was like trauma on trauma, and I ended up just having a relapse. So I finally landed in drug court, but they were like testing me positive for K2 and then coming at me like, oh, you're hiding something, you're sneaking, you're lying to us. And I'm like, send it out for a confirmation test. I haven't used drugs in over a year. By the end of the program, when it happened the second time, it had been almost 2 years. And I was just like, this is ridiculous. I've never used K2 in my life. Like, even now, I'm not on papers. I have a partner. I still haven't used K2 ever. I have no desire to use K2. So I have no explanation for why it's showing up on your drug test, right? But the way I was treated by the staff was horrible. It was horrible. Because I was not given the basic dignity and respect as a human being, trying to actively engage in my own recovery process with some degree of integrity.
Totally understand, Mike. Mike, so let me ask you a question. How did you hear about this bill, treatment not jail, and how did you get involved with it? I understand now why you got involved with it. I guess that was primarily due to your own experiences and wanting to somehow help. But how did you get involved with the coalition Treatment Not Jail, and how did you hear about it?
So I found out about TNJ through a coalition of advocates that have been doing criminal justice reform, like the Center for Community, the Center for Community CCA, Alternatives, and the Cattell Center. And the Cattell Center exists in both Connecticut and New York, which was a unique organization that really aligned with my experience, because I came from Connecticut. I did my time in Connecticut DOC, but now I'm here living in New York, and I work, at the time I was still working inside of a drug court. And when I found out about the bill, I went to the participants in our program. And of course, I educate people about self-advocacy. I educate people about the importance of being involved in community service and being involved in activism and advocacy, and trying to help to continue to foster change. And people were really struggling in the drug court program where I was. And there was a lot of stuff happening that was just, it was hard to be with. I remember talking with this one girl who was like falling apart, because they were trying to she had been taking fentanyl, and they were trying to get her to stop taking fentanyl and jump straight onto buprenorphine. And for people who aren't familiar, because what happens with fentanyl, what's different about it than other opioids, is it actually it sticks in the fat. It's lipophilic, so it means it sticks to your fat. So it'll stay active in your bloodstream sometimes, if it's built up, for up to several weeks after you stop taking it. So people trying to go on to buprenorphine are experiencing really awful precipitated withdrawals. And that's if they can even get into the treatment program. Now I'm scrambling to try to get this person an appointment so they can get inducted that day, because they're demanding that this person stop using drugs right away. And then it's like after the fact trying to figure out, well, then how are we going to get them onto MAT? Because it's not medically unsafe for them to just stop taking the substance, right? Like that's also very dangerous. And so, we would try to scramble to get people into treatment programs, but like our methadone provider had like a 6-month waiting list. So we didn't have anywhere to send people. I had people on the street literally crying with me, like sitting on the street corner, begging to get onto methadone, could not get onto methadone. We tried everything to get these people in the clinic. We could not get them treatment. The other case that I think of very plainly, there was a young lady who came to us, and she had been on medical cannabis for several years and was stable and was doing really well. It worked really well for treating her anxiety. She was under the care of a prescribing physician. She was coordinating care with her primary care doctor. It had worked. And I remember having a conversation with the court advocate who was like, she can't be on this medication. We're going to have her come off and we're going to put her on benzodiazepines. And I was like, what? You're going to take her off a medication that is relatively safe, and you're going to put her on a medication that has known issues with drug dependency and withdrawals. So you're going to destabilize this patient. This patient was freaking out, and this is like day one of treatment. And I'm like, this is not how you build a person-centered relationship. This is not what Oasis is mandating from treatment providers, I'm having an ethical dilemma right now because they're saying we are mandated to provide person-centered treatment. We are not providing person-centered treatment. So when I looked at TMJ and some of the possibilities that I saw with the bill, I mean, it is so important that we pass this legislation. And I say that because right now across the state of New York, every single treatment provider that's working in a drug court is encountering daily ethical dilemmas. Daily ethical dilemmas. And in my view of it, like I could not continue in good conscience to continue to provide the services in the way I was being told that they had to be delivered because it was unethical. And what we were being asked to do as providers was unethical. And for the court to be in the driver's seat making decisions regarding the treatment, not the patient-provider relationship driving those decisions, is equally unethical. Judges and lawyers are not qualified. They are not qualified to weigh in on the treatment decision for an individual. I'm sorry. I went to school for 8 years to get my master's in social work. I have to get clinical supervision work full-time in the field for another 2,000 hours in order to apply for my LCSW. That's just the entry point to get into my field. I'm sorry, but a judge in some counties, they're elected. They don't have any minimum qualifications. And attorneys don't have any training in mental health. They're not qualified. And many, many people are unable to get access to these courts because of whether or not they have a primary diagnosis of a substance use disorder, right? And that's contingent on history, that's contingent on, sociological and economic factors. That's also contingent on how the person is viewed by society. And a lot of times that's driven by race. Is this person somebody who's worthy of help, is deemed a patient, has a clinical record? People who have experienced institutional racism inherently have more distrust towards people that work inside of these large systems, including the healthcare system. So people don't want to be labeled or stigmatized by diagnoses, right? And that's across cultures. People especially don't want to be diagnosed with an addiction because of the way you get treated by healthcare providers after the fact. So a lot of people that need help aren't able to get help because we limit how we make help available so much. And then what happens instead is they go to prison. And that is the worst possible thing that you could do to help somebody.
So, Mike, I want to back up a little bit because I heard you talk about when you got accepted in the treatment. How many times did an attorney or, try to apply to get you into mental health court or to get you into diversion court? And what happened when you finally got in it?
Yeah, so the first time I tried to apply to drug court, I was actually actively in substance use treatment. And I was living in another state and I had actually started to do better. Like I was getting help and I was stabilizing. And then they ripped me out of that environment and they threw me in prison. And we're basically like, yeah, we don't care if you're getting help, you're not getting help. And then because, especially with low-level drug offenses, there's not a lot of time that you're usually given in prison. So if you're not in prison for a certain amount of time, they just won't give you a program because there's not enough time for you to complete the program, or there's a wait list, or, there's a bunch of factors that go into that. Then the second time I applied for the drug court, I was on community release, so I had made bail. I had violated my probation because I relapsed. And it took over a year. It was probably a year and a half before I finally got into the drug court. I was really grateful that, unlike a lot of people, I think, in that situation, I used that year and a half to get help and to work on my recovery. Because the way the drug court is structured, it's so stringent that if I was on day one of recovery trying to follow all these rules and meet all these requirements, do everything they wanted me to do, and I just came out of like, you know, going to crack pipe yesterday, living on that, I would be able to do that without getting sanctioned or violated and sent to jail. And I think a lot of people see that and they won't even take the program because it just feels like a setup. You know, so we have to make these programs more responsive to the actual needs of people.
So when you got into it finally, you said, you started getting the help you need and you successfully completed it.
Yeah. So I successfully completed it. I will say this. I became the first patient in Connecticut's program by the drug court doctor out of medical necessity. They had exhausted every available alternative therapy. Nothing worked for my autoimmune disease. At the end of the year, even though I completed without any relapses, without any sanctions, I went to all my classes. I got, myself back into college. And I was actually heading into social work school and working full time when I left the program. The social worker who worked on my case told me that if we had known about the severity of your medical issues and your mental illness, we wouldn't have accepted you into the program because this program is really for people that use drugs. So they would have left me to spend 20 years in prison rather than get help. I would still be in prison right now. Instead, now I've completed a master's degree. I've worked for years in service to the community. I've worked in homeless services. I've worked in recovery advocacy. I've worked on passing laws and creating public health programs. Like, I've done a lot to give back to society. I bought a home. I pay taxes instead of being incarcerated. I got a pardon. My record's clean now. All these things happen. New York doesn't have a pardon system like Connecticut. And that's another thing that's really hard. A lot of people have to plea bargain to get into drug court. I had to plead out to multiple felonies just to get into drug court. And they wouldn't even let me see the evidence that was being presented against me before I had to accept or reject the plea. So there was no real due process, right? This was circumventing a lot of the due process. So they used that leverage to push me into drug court. And then I had all these felonies on my record. If this had happened to me in New York, I would still have all these felonies on my record. There's no avenue for people to get multiple felonies removed from their record in New York. And that's another big problem.
So, Michael, if you could say one thing to legislators, assembly people, both, and to the community in terms of treatment, not jails, and how important it is, what would you say?
What I would say is that when you think about this bill and you consider how important it is and whether or not to pass it, think about all the children that have to go without their parents, that have to grow up in a life where they're traumatized in a world where their parents are taken away from them and put in prison instead of given an option to go to a treatment program and get help. Think about the people who didn't do absolutely anything to deserve the product of the current system. And we have a responsibility to transform that system so we are not actively causing harm to innocent people. The current system harms not only the people that are affected by it, people who have a substance use disorder, people that have a mental illness, people that have physical illnesses. We got rid of a lot of the social supports and safety nets that kept these people from the kinds of circumstances that lead them to coming into contact with the criminal justice system. We replace that system with prisons. The sad reality is that prisons do nothing but hurt people and destroy communities. And if you want to end the cycle of mass incarceration, if you want to stop the expansion of mass incarceration, then we have to do something different. We have to reinvest in communities. And we owe it to our children. We owe it to the future of the people that we're bringing into this world today and teaching them what it means to be a human being, what it means to support freedom, what it means to live in a democracy in a free country. We incarcerate more people than any of the developed nations. We incarcerate more people than all of the countries in Europe combined. We should be ashamed of that. It is clear that what we're doing is not working, and we have to do something different. I can speak from my personal experience that treatment helped me when I finally got the right treatment. And so we have to reform our programs, we have to make them accessible, and we have to invest in alternatives to incarceration.
Hey, Mike, man, I want to say I thank you. That was an excellent message to the general public and inclusive of, the assembly people and the legislators. And I want to thank you, Michael, for taking this opportunity to be transparent, to be vulnerable, and, to sharing your experiences and demonstrating that a treatment court, a diversion court, does have the ability, the potential to help us as a community become a safer space. Thanks, Mike.
Thank you, Mark.